Humeral head fracture. The humeral head fracture definition common in the elderly patient. The 4 to 5 centimeters of all of fracture. The classification according to the needs. The classification according to the needs. The 4 segment head of the humerus. The head of the humerus fracture. And the greater tubercles. The greater tuberosity. Lesser tuberosity. And shaft of the humerus. The classification, the undisplacement, the undisplaced fragments of one part of fracture, and displacement, the one segment, the displacement one segment to part of fracture, the displaced two fragments, the 3 part of fracture, and displaced all the major part, the 4 part fracture. Muscle force of fraction, the supraspinatus and infraspinatus muscles, the fold, the greater tuberosity, the superiorly subscapulary supports, the lesser tuberosity, medially. Pectoralis major muscles, the adduction, the shaft, medially. Mechanism of action, the pull in the outer state of hand. There is pull in the outer state of hand. Clinical fracture, pain, swelling, most common symptoms. And the weakness and brachial reflex injury. The imaging studies of the anterior posterior and lateral view of the shoulder joint. Here is those humerus, 1 part fracture of head. There is a 2 part of fracture. And here is a 3 part of fracture of the humerus also. The 3 part of fracture. There is a displacement of the 4 parts of fracture, the all major part of fracture, humerus. Management, the conservative pain, the undisplacement of fragment. Undisplacement fracture, immobilized in the plaster slab, operative displacement fracture, and open reduction in the internal fixation also. The complications, early complication, neurovascular injury, late malunion, and vascular neck. Quick response, the quick response, humeral head fracture. The humeral head fracture, the definition common of elderly patient, the 4 to 5 centimeter of old fracture. Classification according to the needs, 4 segment, head of a humerus, greater tuberosity, lesser tuberosity, shaft of the humerus. Classification, undisplaced fragments, 1 part of fracture, displaced 1 segment, 2 part fracture, displaced 2 fragment, 3 part fracture, displaced on the major part, 4 part fracture. Muscle, superior and infraspinatus of greater tuberosity, superiorly. Subscapulary pulse, lesser tuberosity. The proximal part 2 part of proximal, the intra-articular fracture, the anatomical neck and head of humerus, and extra-articular fracture, surgical neck fracture. Distal part 2, supracondyle and infracondyle. Surgical neck is open fracture. There is 2 types of fracture. Surgical neck of open fracture, 2 types. Surgical neck is sometimes abduction fracture, and surgical neck is sometimes adduction fracture. And distal relative proximal, the distal relative proximal physiological position is the best position and to escape of the muscle relaxation. Adduction of the fracture of humerus to the position of abduction and support. Humerus, there are 2 types of joint, shoulder joint and elbow joint. Surgical neck fracture, there is a abduction to injury, the distal part outside, and adduction injury, distal part injury.